There are some differences between hyperglycemia and hypertension. Gerald C. EclaireMD Foundation. 1. Hypertension acute spikes. A single episode of very high blood pressure, for example, systolic 175 mm of mercury, can rupture a fragile vessel and cause a stroke, as you personally experienced. This is because pressure acts mechanically and immediately on blood vessel walls. The damage can be sudden, catastrophic, and irreversible. 2. Hyperglycemia, one-time spike, one-time high blood sugar, for example, after a big meal, usually does not cause immediate, permanent damage. Glucose works differently from blood pressure. The harm from hyperglycemia comes from repeated exposure. Chronic or frequent high glucose leads to glycation of proteins, oxidative stress, endothelial dysfunction, and progressive damage to vessels, eyes, kidneys, and nerves. A single spike may cause temporary fatigue, dehydration, or oxidative stress, but not the kind of instant vessel rupture that hypertension can cause. 3. The real risk with glucose. It is the cumulative effect. Repeated spikes over months and years, that drives diabetic complications. You could think of it as slow rusting of the system, whereas blood pressure is more like a sudden explosion of pressure on a weak pipe. Simplified comparison: acute hypertension, like a burst of water pressure that can rupture a pipe immediately. Hyperglycemia, like sugar water corroding pipes over time. One spill does not destroy them, but repeated exposure weakens them steadily. So in summary, one acute hypertension episode can cause immediate stroke or heart attack. One hyperglycemia episode rarely causes permanent damage, but repeated hyperglycemia over time is very dangerous. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.